Is it true that we should stop taking tea?
She's asking if it's true that we should stop taking tea. We talked about it. I don't know the class we talked about it. The ideal thing is, I'm not saying you should stop taking tea. What we are looking at is the sugar content. The sugar. The more the sugar you pump into the system at a particular time, the more the insulin that is released, the more tendency that woman have a gestational diabetes. And once there is gestational diabetes, that increases the size of the baby. And the bigger the baby you deliver, the more the risk of the baby dying. In fact, a baby that weighs 3 kg, for example, is healthier than that other one that weighs 4.5 kg. The bigger the baby, the more risk it is to the baby, because most of those big babies are born from a mother that is diabetic. But if the woman is naturally healthy, the woman is big naturally, the husband is also big naturally, you see that it's a genetic thing, not really coming from diabetes, then there is no complication with that particular size. But those babies that are big, courtesy of the fact that there is always insulin being pumped, there is always glucose being pumped into the system, and eventually become big, courtesy of gestational diabetes, they have a higher tendency of child death than normal size adults. So to avoid that, we don't want to give too much surge of sugar at a time. Do you understand what I'm saying? In that way, that person can decide to take Milo without milk, or milk without Milo, or milk and Milo. But once the sugar content is so high, what it simply means that there is always a surge of glucose into the system. And once there is that surge, the insulin will be released in that surge, and the swing will continue. The baby will take too much sugar, and what you have is a macrosomic baby. Number one is that you will know what we are talking about when we enter the labor room, because it's easier to deliver a child of 3 kg than to deliver a child of 4 kg. Let's just be sincere. I don't know if you understand. The smaller the baby, the better, and the smaller the stronger. No, at a particular, it's not a child that is reduced weight like 1.5, but after 2.5 kg, any other weight you are adding is going to be a stress to the mother and also a stress to the baby. So it's just the weight of the baby you are concerned about when you are talking about. Zobo is good, but what I'm saying in essence is that we are concerned about sugar. You see, when a woman have diabetes, he tries to born baby that are bigger than normal. If you have hypertension, he born a baby that is smaller than normal. Then the baby that is born of a hypertensive patient is usually stronger than that one of a diabetic mother. But Zobo is good. I don't know what it contains, but Zobo is. In fact, there have been a research which was done by cardiology. It's like from Parkland or UNTH, which shows that Zobo is very good. I didn't say you should make Zobo your drink now and start drinking Zobo. You go and meet your husband at any time. Why not use Zobo? My concern is that sugar, and my concern in the sugar is the refinedness of the sugar. If the sugar is not refined, yes, the system has a way of releasing it small, but refined sugar, no. Sometimes these lectures are more important than even the drugs you can ever think about. If not that, a lot of women will take so many drugs. Please, from today onwards, every drug that we take has to be justified. It has to be justified. It has to be justified. Thank you very much.